Did you know that according to fresh research conducted on mice, a necessary RNA molecule vital for the survival of female mice guides the body towards an immune response that ends up hitting closer to home than expected? In this video, we will discuss the growing prevalence of autoimmune diseases in women and the unique challenges they face. Imagine your body's defense system going into turbo mode and starting to attack the very cells it's supposed to protect. That's what happens with autoimmune diseases. Your immune system mistakenly targets your healthy cells. According to the data from the National Institutes of Health, autoimmune diseases seem to have a gender bias. Women are 3 times more likely to be affected than men. Just to give you the big picture, of the 23 million Americans dealing with an autoimmune condition, about 17 million are women. For about 1 in 10 people, predominantly ladies, the immune system goes haywire, attacking their own body's cells. This leads to over 80 different types of autoimmune diseases, such as lupus, multiple sclerosis, and rheumatoid arthritis. Now, you might wonder why women seem to get the short end of the stick. Well, recent studies offer a clue. The culprit might be a glitch in the system that's supposed to turn off one of a woman's 2 X chromosomes. Common autoimmune disease symptoms. The world of autoimmune diseases is broad and varied, yet many of them manifest in similar ways. Here are some typical indications you might be dealing with an autoimmune disease. Unusual tiredness, aching joints and swelling, skin issues, stomach discomfort or digestive problems, persistent fever, enlarged glands. Many women reveal that getting a definitive diagnosis can be challenging. It's not a clear-cut process. Autoimmune diseases don't typically have a singular diagnostic test. Instead, they require a combination of particular symptoms, distinct blood markers, and, occasionally, a tissue biopsy. It's never just about one component. Adding to the complexity, these symptoms can often mimic those of other prevalent conditions, making diagnosis all the more tricky. Hence, women need to seek medical attention when they spot new or unusual symptoms. Suppose you've always enjoyed good health and then suddenly start to experience constant fatigue or stiff joints. In that case, it's crucial not to ignore these changes. By sharing these symptoms with your doctor, you're allowing them to understand your health situation. They can then run tests to either confirm or dismiss the possibility of an autoimmune disease. Remember, when it comes to your health, there's no such thing as oversharing. There are certain autoimmune disorders that, for reasons unknown, are more likely to impact women than men. Here are a few examples. First up, we have Sjogren syndrome. Rather than defending your body, it turns against it, specifically targeting the cells responsible for creating moisture in your body. This typically results in extremely dry eyes and mouths. What's more, it often keeps some unsavory autoimmune companies showing up alongside other similar conditions. And guess what? It's 9 times more likely to occur in women than in men. Next is systemic lupus erythematosus, or SLE for short. This is another autoimmune disorder where the immune system seems cross-wired and begins to attack various parts of your body. SLE tends to make its unpleasant debut between the ages of 15 and 44. And, startlingly, 9 out of every 10 people diagnosed with SLE are women. Finally, let's talk about rheumatoid arthritis. This autoimmune disease seems to have a particular preference for your joint tissue. Of every 7 folks who get hit with this condition, 5 are women. Now, the question is, why are women more susceptible to autoimmune diseases? Researchers and doctors have noted that it has something to do with how the female immune system works, not to mention the influence of sex hormones. The immune system of women behaves a bit differently when provoked, compared to men's. For instance, if both a woman and a man encounter the same infectious disease, the woman's immune system will likely jump into action more readily. While this can be beneficial, sometimes the response might be overzealous. It can escalate to a point where it causes inflammation, damaging perfectly healthy tissues and organs. This overaction, in turn, raises the woman's chances of getting an autoimmune disease. But the story doesn't end there. Another factor making women more prone to these conditions involves hormonal differences. Many of these autoimmune diseases seem to ebb and flow in response to changes in female hormones, particularly during pregnancy. Therefore, hormonal shifts can throw another curveball, making women's battle with autoimmune diseases more complex. Please keep in mind that heredity and lifestyle habits significantly shape your health. Your genetic predisposition plays a large part in your health, whether male or female. It's common for autoimmune diseases to appear within the same family, yet the type of disease might differ among relatives. For instance, your mother might be living with rheumatoid arthritis. At the same time, you're diagnosed with Hashimoto's disease, and your aunt struggles with lupus. The genetic aspects of autoimmune diseases are intricate, and we need more scientific studies to unravel these perplexing links. Your stress levels and general health condition also have a bearing on your likelihood of acquiring an autoimmune disease. To shield yourself, It's crucial to maintain a balanced diet rich in fruits, vegetables, and whole grains. Regular physical activity helps keep stress at bay, and ample sleep is equally important. Remember, your health is a precious asset. Treat it as such. Suppose you are living with lupus, rheumatoid arthritis, or psoriatic arthritis. In that case, you should be aware that these conditions could raise your chances of developing heart disease. So, putting measures in place to lower this risk is not only prudent but is absolutely vital, especially if you have one of these conditions. Chatting with your healthcare provider about the different methods you can adopt to ensure your heart remains robust and healthy is smart. For instance, managing your blood pressure and cholesterol levels, maintaining a balanced diet, and making physical activity habitual could save your life. Adding these steps could also contribute to controlling the symptoms associated with autoimmune diseases. In more severe scenarios, doctors prescribe immune-suppressing medications to halt the body's immune reactions, which can otherwise cause more harm. However, using these medications can make you more prone to catching infections. It's true, balancing a hectic lifestyle with healthy habits can be quite challenging, especially for women who are constantly on the go. But remember that striking this balance significantly aids in managing autoimmune diseases. So, despite the hustle and bustle, it's essential to carve out time for your health and well-being. That's a wrap. Remember, it's never too early or too late to start caring for you. We hope you liked the video. Do not forget to subscribe to our channel for more informative content on health and wellness.